little vampire. You're new. What brings you to our office today? You're brand new. Let me. Oh dear, you are new. What happened? Come in, have a seat. Dr. V will take care of you. But what happened? Who turned you? It's not the turning point yet. No, the vampires have a code. We have 2 weeks, 4 times a year, to go out and play with our prey. And it's not time yet, so you, my innocent little baby vampire, are going to be well taken care of. And whoever turned you is also going to be taken care of as well. But in the meantime, we are going to get you checked out and get you up to speed on your new life, okay? Okay. So, I have a few questions to ask you if you don't mind. Just so we know for our own records in our community where you came from and what circumstances led to your turning. Every vampire has their own origin story. Okay, so your name, and would you like to keep that name or take a new one? Keep it, okay. And your date of birth. Okay. And your date of death or turning. Was less than 24 hours ago. Somebody's in trouble, but it's not you, I promise. And do you remember where you were when you were turned? No. Okay. Do you remember what you were doing the day before you were turned? No as well. Well, if you can't remember the day before, you won't remember anything prior. Unfortunately, sometimes when vampires are turned, they lose all memories of their previous life. However, this is not such a bad thing. It prevents all that, forever guilt when you go and accidentally eat a family member during the season. So, you're probably better off. In the meantime, I would like to get you checked out. So, I would like you to just sit there and look straight at me. I'm just going to very gently examine your face. Just want to make sure that we're not seeing any signs of infection. Because if a vampire is trying to hunt out of season, it could be a virus that he or she or they are infected with. And we don't want that being transmitted to the community, so I don't worry about me. Oh, nothing's gotten me in the last 964 years. And I don't think something will get me now. Alright, and lean your neck back from me. I just want to look at the bite marks and see if we can determine. Oh, interesting. Hold still for me. I'm just going to take this post-it note, place it over that spot, and just make a mark so we can measure the bite mark distance. That is going to heal up very soon, most likely by the end of the exam today. But that's a good thing, because being a vampire means you get to heal very quickly. It also means you get amazing sight, amazing hearing, increased olfactory response. You no longer have to eat human food, but you can if you want, just in moderation. It will take your body some time to adapt to the fact that it no longer needs to digest or process human food to live. However, as you probably are aware, vampires do need blood to survive. But we have an amazing agreement with many blood banks across the country. So the blood supply is never low. How? Well, where do you think all those volunteers come from that call and ask you to donate blood? It's very simple. We don't want to hurt people, but as I said, we do have hunting seasons because, well, you'll know in a few weeks when you start feeling that urge to go out, when you smell that hint of iron on the air, and you can taste the copper on your lips. But we won't worry about that for now. But we do want to check you out some more. Alright, my little baby vampire. I'm going to take a look inside your ears now. I'm just going to use my otoscope here, and I'm just going to look inside to see if the physical changes have started to occur. And it looks like they have. Your tympanic membrane has widened. You now have very fine and sensitive hairs inside your ear. Yes, very good. Very good. Very good. Very nice. And I'm going to slip the otoscope in on this side and take a look inside. And it looks like the same thing. The same thing. Very good. Beautiful. Well, your ear transformation is looking well underway and very, very healthy. But I would like to just do some hearing tests with you, just to make sure that your hearing is coming along as well. So I'd like you to close your eyes for me, baby vampire, and let me know which ear you hear the noise in. Good. 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 Very good. Very good. And now keep those eyes closed for me. And I want you to repeat the word you hear that I whisper in your ear back to me. Blood. Good. Hunt. Good. Midnight. Good. Coffin. Very good. Eternal. Good. Inevitable. Wonderful. Alright, vampire. Open those eyes for me, because we are going to be looking at them next. So, just look straight at me, little baby vampire. And let me look right into your eyes. Let me look to see if that feral ferocity has sparked in those irises. Did you get an eye color change? Maybe you're one of the lucky ones that gets violet. Or maybe the blood red Sometimes the color change doesn't happen until after the first hunt. But I'm gonna take a look inside your eyes because, like your ears, your ocular nerve should have strengthened and thickened. Your eyes will develop more cones to allow you to see more colors and on different color spectrums. So open your eye, look at me, and I'm just going to look inside. Look at that beautiful ocular nerve. Go ahead and look up for me, baby vampire. Good, and down. And to your left. And to the right. Good. And we're going to look at the other side. So same thing, open your eye and look straight. Beautiful. And up. Good. And down. Good. To the left. And to the right. Good. Wonderful. Those eyes are coming along nicely, which means that you should be able to read everything on that eye chart back there without me having to point to anything. So read it. Look at that speed and accuracy. Isn't it nice to be the peak apex predator on the planet? Heightened sense of agility, heightened cognition, intelligence, everything about you now is perfection. And it's wonderful to be on top. But let's make sure those eyes of yours are working properly. So look at me and just follow my finger, little baby vampire. Just follow my finger. Good. Good, baby vampire. Good. And over here. Good. Good. And now we're going to test to see if you still have a pupillary response, which you should not. So we're swing the light in, and then out, and then in, out, in, out, in, out, in, and out. No response. Perfect. And then we're going to swing in, out, in, out, in, out, in, out, in, and out. No response. Wonderful. Okay, baby vampire. We're going to continue testing those eyes of yours now. I'd like you to look at my finger. Do not follow the light. Just look at my finger. Don't follow the light. Good. Good job, baby vampire. Good. Good. Go ahead and blink a few times. Good. Now look straight at me without moving your head. Follow the light just with your eyes. Just with your eyes. Good. Good. And now close one eye and follow the light again. Good. Doing a great job. Good. Now close the other eye And same thing for the light. Good job, baby vampire. It's not so bad. Dr. V will take care of you. We even have a nice coffin in a private room all ready for you tonight, so that you have a nice, safe place to stay. And then we will introduce you to the rest of our wonderful little community. Good. Alright, little vampire. Pay attention to the finger and let me know when it runs out of your vision and then in, okay? And good, 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 good job. Good. Alright. Good. Look at that. Those reflexes so quick. I'd love to see it. You are progressing so nicely. Alright, little vampire. Few more eye tests and then we will move on to other things. So look straight at me. I'm going to bring the light in very close and I want you to let me know, does the bright light bother you? Because sunshine sure will, but artificial light should not cause you any kind of problem. Good. And I'm going to bring the light out and bring it in again. Good. And bring it out and bring it in again. Good. And on the other side, I'm going to bring it out and in and out and in and out and in. Good. So now I would like to check you for a pulse. I know, but it can be quite rude to ask a vampire or a suspected vampire to check their pulse upon first meeting them. It's just etiquette, but I am convinced you are a vampire, so lean your head back for me. I'm just going to take my fingers and press them to your neck and feel for a pulse. Dead, quiet, beautiful. But to be on the safe side, I would like to just listen for any remnants of heartbeat, if you don't mind. Just sit back and relax, and I'm just going to listen. And I hear nothing. Good. Good. I can gladly say that you are officially not alive. Welcome to immortality. But speaking of immortality, you also need to learn how to take care of yourself. And as I said, in the community, we have access to plenty of blood. But as a new vampire, you must be very, very careful about your first feeding, which is why we have prepared our very own blood jello for baby vampires. It is very easy to consume. It is very, very sweet, but also concentrated and full of nutrients. It is an oral syringe, so we can squeeze it right onto your tongue. And you must be hungry, little one. So just relax, open up, and we will just give you your first taste of blood. Look at that, you're so hungry. Oh yes, just drink it all, it's fine. We need you to be nice and strong. little more. There you go. Good job. Okay. How was that? Your first taste of blood? I know, it might take a little getting used to, but you will. And over time, after your first, probably about a year, the cravings will subside. You will be able to feed basically as frequently or as infrequently as you want, as long as you feed at least 5 times a year, minimum. Alright, so just relax for a little bit, let that digest, okay? And I'm gonna just change my gloves, and we will get back to your exam. Okay, little vampire. How are you feeling after that first bit of jello blood? More like yourself. Good. We have more if you're hungry, but we do have a few more things to do. So, one of the things, speaking of blood, is going over your new anatomy, and that includes checking out your teeth. So, as I'm sure you've noticed, I have my fangs, and your tongue has probably discovered your own fangs. So this is an example of what a vampire fang looks like. This happens to be a medium to largest size. These types of fangs in our species are not normally retractable. However, some of us get very lucky and have retractable fangs that will actually slide up into the gum line and look like a normal canine, but will slip right back down when it's time to feed. And our fangs are hollow at the tips so that blood will flow up and through. It's quite convenient for us, but we can also drink it. So, little vampire, do you have any questions about your new anatomy? No? Okay. I know, it's pretty straightforward. I would like to ask you how you're feeling, how you're handling all of this, because it's quite a lot to deal with. I know, I still remember when I was turned so many centuries ago. Oh, that's a story for another day, little vampire. You are fresh from the grave, and frankly, you need to get your rest so that your body can finish its transformation, and it is also almost sunrise, so it's time to get you to sleep. You can just lay back on the table here, or we can get you into your coffin, and you can just rest those baby vampire eyes and relax. Dr. V will take care of you, little baby vampire. So you just rest. And I want you to go to sleep. Go to sleep.